just called her Nugget and Charlie.
Carol, thanks so much. We'll see you in about half an hour. Thank you.
Thank you.
Now, it is less well known than other forms of the disease, but cases of mouth cancer in the UK have increased by nearly 40% in the last decade.
That's according to research by the Oral Health Foundation, which is calling for changes to education and improved access to NHS dentistry to try to bring those numbers down. Dr.
Tripat Mahajan, who's from the Mouth Cancer Foundation, joins us now. Good morning to you. Alongside Adele Freeman, BBC producer and a mouth cancer patient. You're both very welcome this morning. Adele, would you start us off by sort of explaining what happened to you? What's the story?
I was on holiday last year and I had toothache. And we came back from holiday and I went to our dentist and I said, oh, my tooth's hurting. And he said, oh, it's cracked. You must have it out. So a week later, I had the tooth out. They left it. About 3 weeks later, it hadn't healed. I was drinking water. If I drank too much, the water was then coming out my nose, which I thought was a bit strange. Went back to the dentist and said, it's not healing. He said, you've got fenestration of the sinus, where your tooth root meets your sinus. It needs to be surgically closed. So I had it surgically closed, and the surgeon said to me afterwards, oh, your sinuses are a bit infected. Off you go, see you in 6 weeks. And then about 10 days later, he rang me and he said, I'm really sorry, but you have microscopic cancerous cells in your sinus. And then he made me an appointment with a colleague of his at a regional maxillofacial centre. And I went in to see this guy, and the first thing he said to me was, this is really serious. You're facing a 12-hour operation. Your mouth is going to have to be reconstructed. Your teeth are going to have to come out. And I was just, like, completely thrown by it because, you know, I thought I had a sore tooth.
What did happen in terms of treatment?
So I had lots of scans and checks and everything else. And then he said to me, if you want a second opinion, you can have it. And I decided that I did want a second opinion. So I went to the Royal Marsden Hospital in London, had a second opinion. And the guy I saw there agreed with the first guy that I'd seen. And then I went into this 13-hour operation, it was in the end, where my teeth from here backwards were taken out at the top. My jawbone was taken out. My mouth was reconstructed with a soft reconstruction from skin on my arm. Skin from my leg was taken to cover my arm. I woke up the following day with a gastric nasal tube in my mouth, in my nose. Was tube fed for 10 days in hospital. I also had the lymph gland taken out my neck.
Well, I mean, you clearly have been through a terrible ordeal. I suppose the upside, it was spotted. Yeah. Doctor, we mentioned at the beginning this 40% rise. I think it's the last 10 years or so. Is there any accounting for this?
I think it's difficult to pinpoint and say exactly the reason why these cases have gone up, but I think we can probably then look at the risk factors and see what might be causing this. So common risk factors are smoking and any tobacco use, such as betel nut chewing, excessive alcohol consumption, and actually both of those, if you smoke and drink alcohol together, it increases your risk by 30 times, which people might not realise. And another risk factor is the HPV virus, the human papilloma virus. There are multiple strains of this virus, but in one particular strain is known to cause cancers, especially in the back of the throat, so oropharyngeal cancers. And those are actually more common in younger people. We're seeing those in younger people, and that's the fastest increasing rate and type of cancer at the moment within the head and neck. So we could say that these could maybe explain some of those figures, but it's difficult to say.
It's interesting because you were at the dentist.
Yeah.
It was a toothache. That's how this emanated. So many people would associate something like a toothache. What are the kind of pinpoint, the touch points where you know that this can be spotted?
Well, you said it exactly right. So things can pop up in the mouth. We can get ulcers. You can get something that will then heal and go away. We're looking at things that are persistent or unexplained that don't heal after about 3 weeks or so. So common things that people might have heard of are non-healing ulcers that have lasted more than 3 weeks, a lump in the mouth, the jaw or the neck, any red or white patches or red and white patches. And also some more important but also maybe not so well known are unexplained bleeding or looseness of teeth all of a sudden, a non-healing socket, a bit like what Adele was just saying, you know, something hasn't quite healed and you go back and say, actually, why is that not healed? Or, you know, a change in your bite or ill-fitting dentures all of a sudden. And then going to the throat...
Can I just... Sorry, if you're going to the dentist and you say you've got toothache, I get that, because obviously the dentist, and they do more examinations around the head and the neck anyway as part of the consultation. If you're concerned and then you call the doctor and say, I've got toothache, do they kind of hear that there's a potential problem there? Or would you be referred to your dentist? Do you see what I mean?
So if it was particularly about a tooth, it might be to go to the dentist. But
that's what you felt, isn't it?
Yeah.
Yes.
Yeah.
But I think there are other symptoms such as a non-healing ulcer, or even if you're looking back to the throat, so persistent throat pain or sore throat, or the sensation of a lump in the throat, or difficulty swallowing, or change in your voice or hoarseness of the voice. These are also symptoms, and that's maybe when you would go to the doctor for it. So doctors are also aware. We're trying to increase awareness amongst the medical profession as well, but GPs, for example, would be hopefully aware of
We
this.
talk quite a lot about dentists and their role in this.
Yeah.
I mean, one very obvious problem is a lot of people have problem accessing dentistry.
Yeah.
A lot of people just don't go to the dentist because it's too expensive, they can't get one. Presumably, that adds to the problem because other things that might otherwise be identified aren't because people aren't going to the dentist.
I think it's then, I mean, it's important then to have a self-check and be aware of a self-check examination. And I'm an ambassador for the Mouth Cancer Foundation, and we have a self-check video online which explains how to look for something like this within the mouth and the head and the neck. And it also shows photographs of things that you might be looking out for or unusual things that might present. And I think everyone still has, I know it's a difficult problem that I in one day can't solve, but people still have access to healthcare. You can still see an emergency dentist, you can go to your doctors and flag and advocate for yourself if you are worried about something.
And Adele, I assume, given your experience, you would absolutely endorse what the doctor's saying about just a basic awareness of what's going on.
Absolutely. I mean, I'm not a smoker, I'm not a drinker, and I absolutely had no idea.
Thank you so much for sharing your story with us today. And Doctor, thank you for your time as well.